Most people assume diabetes only shows up on a blood test. You sit in the waiting room, the results come back, and that's the moment everything changes. And honestly, that's what most people believe until they learn the truth. Because here's what medical research keeps showing us, week after week. Your body starts sending you messages about high blood sugar long before any lab ever would. And the very first place it speaks up, your feet. We're sharing this today because too many people are walking around carrying warning signs they've been living with for months, sometimes years, without ever knowing what those signs meant. Today, we want to change that for you. If you're new here, welcome to Health is Golden, Hisi, where we break down the health information that actually matters in plain language. Hit that subscribe button right now and turn on notifications so you never miss a video that could change your life. Here's a real example of what this looks like. Imagine a 67-year-old man going in for a routine checkup, feeling perfectly fine. Before his blood work even came back, his doctor asked about his feet. He shrugged and said, "They've been a little numb for a while. I figured that's just what getting older feels like." He had 4 of the 9 signs we're about to show you. His fasting blood sugar came back at 214. He had been diabetic for over 2 years and had no idea. So let's walk through exactly what those signs are. Sign number 1, tingling or numbness. My foot just falls asleep. Almost everyone has experienced this, and almost everyone has explained it away. I was sitting with my legs crossed. Sure, that happens occasionally. But when it's happening regularly, without any obvious reason, that's when we need to pay attention. Recurring numbness or tingling in the feet what doctors call peripheral neuropathy is one of the earliest signs that blood sugar has been elevated for some time. Excess sugar in your bloodstream slowly attacks the protective coating around your nerves. Think of your nerves like electrical wires. That coating is what lets signals travel cleanly from your brain to your foot. High blood sugar is like an acid quietly eating through that coating. The wire still works for a while, but the signals start getting fuzzy. That fuzziness, that's the tingling. The American Diabetes Association estimates that peripheral neuropathy affects nearly half of all people with diabetes, and it almost always starts in the feet. Right now, millions of people are experiencing this and writing it off as nothing. What helps? A 20 to 30 minute walk every day. Not a jog, just a walk. Movement keeps blood flowing to your feet and protects those nerve endings. And start cutting added sugar today, not next month. Today, if sign number 1 sounds familiar, type sign 1 in the comments right now. You might be surprised how many people are experiencing the exact same thing. Sign number 2, burning feet at night. I thought it was just fatigue. This one hits hardest when you're alone at night, trying to sleep, with nothing to distract you from it. People describe their feet feeling like they're on fire. They blame a long day, the summer heat, or just getting older, and sometimes that's all it is. But when the burning is consistent, especially at night when you're lying still, that's a signal worth taking seriously. Here's what's actually happening. Nerves damaged by excess sugar start sending incorrect signals to the brain. Your brain receives a heat message even though nothing hot is touching your foot. It's like a fire alarm with a faulty sensor. The building isn't on fire, but the alarm is screaming anyway because something inside it is broken. Research published in Diabetes Care found that burning foot pain is one of the first symptoms reported by patients who are later diagnosed with type 2 diabetes, often appearing 1 to 3 years before any formal diagnosis. 2 habits that help. Drink at least 8 glasses of water a day. Hydration helps your kidneys clear excess glucose. And add more fiber to your meals, vegetables, legumes, oats. Fiber slows how quickly sugar enters your bloodstream, which gives those damaged nerves a chance to recover. Sign number 3, a small wound that won't heal. I was going to give it another week. This is where things stop being uncomfortable and start becoming genuinely dangerous. A common scenario, a small blister from a shoe 3 weeks ago still hasn't closed up. Most small wounds do heal on their own, but not when blood sugar is elevated. High blood sugar causes the tiny blood vessels throughout your body, including the ones in your feet, to narrow and stiffen. That means oxygen, white blood cells, and the nutrients that repair tissue can't reach the wound efficiently. Picture trying to water a garden through a hose with a serious kink in it. The water exists, it just can't get where it needs to go. 1, your body has everything it needs to heal that wound. It just can't deliver it. An open wound that won't close is an infection waiting to happen. The CDC reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, over 100,000 per year. Almost all of them started as a small wound that was ignored. Tonight, after your shower, sit down and carefully look at both feet. Between every toe, your heels, the soles. If you see any cut, blister, or broken skin, clean it, apply antiseptic, and cover it. If it hasn't improved within 48 hours, call your doctor. Not next week, 48 hours. This is the kind of information that saves lives, and most people will never see it. Share this video right now with someone you care about. One share could make all the difference. Was sign number 4, skin discoloration around the ankles. I always had dark skin there. This one is hiding in plain sight. Many people notice their ankles look darker, more reddish, and chalk it up to sun damage or just how their skin has always looked. That might be true, but there's a specific pattern of discoloration that's worth knowing about. When circulation is compromised, the lower legs and feet don't receive enough fresh, oxygenated blood. The skin changes color, darkening, a deep red, sometimes even a bluish tint around the ankles. In some cases, the skin also becomes thinner and more fragile, a sign that the tissue isn't being properly nourished. Think of your blood as a delivery truck. Your feet are at the end of the longest delivery route in your body, furthest from your heart. When the roads narrow from blood vessel damage, the deliveries stop arriving on time. The skin, starved of oxygen, changes color. It's a distress signal you can actually see. A study in the Journal of the American Academy of Dermatology found that these skin changes are detectable on average 18 months before a formal diabetes diagnosis. Simple daily habit: 5 minutes of ankle circles, toe raises, and calf stretches every morning. Even that small amount of movement gets blood flowing into your feet. If exercise is difficult, elevating your feet slightly while you sit can make a real difference. Sign number 5, cracked heels that never get better. I just have dry skin. This one surprises people the most because it looks so harmless. Cracked heels every winter, fixed with more moisturizer, that's extremely common. But when heels are cracking badly in the middle of summer, or when no moisturizer seems to help no matter how much you use, that's a different situation entirely. Diabetes affects the autonomic nerves, the ones that control functions you never consciously think about, like regulating moisture and sweat in your skin. When those nerves are damaged, the sweat glands in your feet stop working properly. Your feet lose moisture from the inside out. No amount of lotion fixes the root cause. Think of your skin like a wall that needs to stay sealed. When those nerves are damaged, the mortar between the bricks starts crumbling. Cracks appear. And those cracks aren't just cosmetic, they're open doors for bacteria and infection. In a foot with poor circulation, that infection can escalate quickly. 2 habits: moisturize your feet every night before bed. A good lotion or pure coconut oil works well. Focus on the soles and heels, but never apply moisturizer between your toes, as trapped moisture can cause fungal infections. And keep up with your water intake. Your skin needs hydration from the inside just as much as the outside. We're halfway through, and this is the part where we ask you to pause for just 1 second. If this video is giving you information you didn't have before, hit the like button right now. It costs you nothing, and it tells YouTube to show this to more people who need it. You could be helping someone you've never even met. Go ahead, we'll wait. Sign number 6, persistent foot and ankle swelling. I'm on my feet all day. Of course, feet swell after a long day standing. That can absolutely happen. But when your feet and ankles are consistently swollen and you're leaving deep sock marks every single evening, the picture changes. High blood sugar damages the kidneys over time, and your kidneys are what control your body's fluid balance. When that filtration system is under stress, fluid accumulates in the lowest part of your body, your feet and ankles. Think of your kidneys as a water treatment plant. When the filters are damaged, the system backs up. Excess fluid has nowhere to go, so gravity pulls it downward. Press your finger into the swollen area, so if the indentation lingers, that's called pitting edema, and it's not something to ignore. The National Kidney Foundation reports that diabetic kidney disease affects roughly 1 in 3 adults with diabetes, and lower extremity swelling is frequently the first visible sign. What helps? When you rest, elevate your feet above heart level. Even a pillow under your ankles makes a difference. And reduce your sodium intake. Salt causes your body to hold onto water, making edema significantly worse. Check labels. Many canned and processed foods are loaded with it. And if the swelling is new, worsening, or persistent, mention it to your doctor at your next visit. Don't wait. Sign number 7, foot pain, blamed on arthritis. I've been taking ibuprofen for months. This is one of the most commonly misdiagnosed signs, especially in men. An old sports injury, maybe arthritis, the ibuprofen helps a little. And that's a story many people tell themselves. And sometimes that's exactly right. But sometimes the pain has a completely different source, one that ibuprofen will never touch. When nerves are damaged by chronic high blood sugar, they don't always go quiet. Sometimes they become hyperactive, firing random intense signals that the brain interprets as severe pain, stabbing, electric, like a hot needle through the foot. It's often worse at night when there's nothing else to distract from it. Think of a car alarm damage in a minor fender bender. Every few minutes, it goes off for no reason. Nobody's breaking in, the alarm is just broken. That's what a damaged nerve does. The pain is completely real, but its source is nerve dysfunction, not injury. And masking that signal with pain medication is the last thing you want to do when your nerves are sending out a distress call. A study in the New England Journal of Medicine found that painful diabetic neuropathy affects roughly 25% of people with diabetes and is frequently mistaken for arthritis or age-related joint pain. What helps? 5 minutes of gentle foot and ankle stretching every morning before you get out of bed. Flex your feet, circle your ankles, gently pull your toes back. And every night, before bed, a light 3-minute self-massage along the sole and up the ankle. Do you know someone who's been blaming foot pain on old age or an old injury? Share this video with them directly. It takes 5 seconds and it could point them toward answers they've been looking for. Sign number 8, cold feet that never warm up. I've always had cold feet. There's a difference between cold feet in winter and feet that are cold in July. Cold under 3 blankets when the rest of your body is perfectly warm. That second scenario suggests that circulation to the lower extremities has been significantly compromised. The blood vessels have narrowed or stiffened to the point where warm blood simply isn't reaching your feet in adequate volume. Picture a heating system running pipes to every room in a house. When those pipes narrow, the heat doesn't make it to the far end. The room stays cold no matter how hard the furnace runs. That cold isn't about the weather, it's about the pipes. The American Heart Association identifies peripheral artery disease, caused by narrowed blood vessels, as affecting over 8 million Americans, with diabetes being the single largest risk factor. Cold feet are one of its earliest and most consistent symptoms. Best response: a 30-minute brisk walk every single day. Not a stroll, a purposeful, arm-swinging walk. This forces circulation into the feet and lower legs, strengthens blood vessel walls, and over time can begin to reverse early narrowing. Start with 10 minutes if 30 feels like too much. The important thing is to start today. Sign number 9, hair loss on the lower legs and feet. I never even noticed that. This is the one almost nobody talks about. It rarely makes it into health brochures and most people walk right past it every day. Look at the tops of your feet and your lower legs. If the hair there is significantly thinner than the rest of your leg or absent entirely, that's worth paying attention to. Hair follicles need a steady supply of blood and oxygen to function. When circulation has been significantly impaired for a long period, the follicles in the lower legs and feet slowly stop receiving what they need. Over time, they stop producing hair entirely. Think of hair follicles like small plants in a garden. When the irrigation pipe narrows, they don't die suddenly. They just gradually stop growing. The absence of growth is a message from your body about your blood vessel health, visible every time you glance at your legs. Research published in Diabetes states, obesity and metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients, and it's something physicians are specifically trained to look for. Right after this video, look at your lower legs and the tops of your feet. If the hair is significantly thinner or absent, schedule a blood glucose test this week, not this month. This week. It runs about $12 at any certified lab and is covered by Medicare for most people. $12 can change the entire direction of your health. We've covered 9 signs. 9 chances to catch something before it catches you. And here's something important to be honest about. One of the hardest realizations a person can have is discovering they've had every single one of these signs for 2 years without knowing what they meant. Not because they didn't care. They cared deeply. They just didn't have the information. Now you do. So here's all we're asking. Tonight, before you go to bed, sit down and look at your feet. 30 seconds. Look at the skin. Check between the toes. Notice any numbness. Look for anything that shouldn't be there. 30 seconds. If anything on this list applies to you, call your doctor tomorrow. Not next week, tomorrow. Because the earlier this is caught, the more completely it can be managed. In most cases, through something as simple as a change in diet, a daily walk, and a conversation with your doctor. You've worked hard for the life you have, your independence, your health, your ability to do what you love. Awake! Don't let something as manageable as blood sugar quietly take any of that from you just because nobody showed you what to look for. Now you know. Here's what we need you to do right now. 3 things. 1. Drop a comment below and tell us how many of these 9 signs have you noticed. Even 1. Just type the number. We see every single comment and we want to hear from you. 2. Uniques, share this video on Facebook and tag someone who needs to see it. A parent, a sibling, a friend, a neighbor. You might be giving them something they didn't know they needed, and that matters more than you know. 3. Subscribe to Health is Golden and turn on your notifications. We post new videos every week covering the health topics that actually matter, explained clearly without the medical jargon. Your health deserves that kind of attention. And so does the health of the people you love. This is Health is Golden. Stay aware, stay proactive, and please take care of those feet.